Welcome to our At Home Together webinar featuring Banner MD Anderson Cancer Center. I am pleased to serve as your moderator for today's discussion. My name is Becky Kuhn. I'm the Chief Operating Officer of Banner Health, and I am privileged to be bringing the best of Banner Health right to you wherever you are. Today, we will hear firsthand from three program leaders: the Director of Banner MD Anderson Cancer Center, Dr. Rogerio Lillenbaum, the CEO of Banner MD Anderson, Lamont Yoder, and the Chief of Clinical Research and Interim Chief of Cancer Medicine, Dr. Tom Dragovich. We appreciate you tuning in. You will have the opportunity to ask questions to any of the presenters at the end of the program. We intend to cover a lot of ground in just 1 hour's time. Today's session is being recorded, so the audience is muted during the presentation. As I mentioned, there will be time at the end of the program for questions, so please submit them at any time throughout the program using the chat icon at the bottom of your screen. I will moderate the Q&A portion of our program, and whatever questions we are unable to get to will be included in the FAQs that will be posted to a resource website following the program. With that, let's get started on today's program, Rising to the Challenge: The Future of Treatment and Research at Banner MD Anderson Cancer Center. So from a personal perspective, I have had the privilege of seeing Banner MD Anderson Cancer Center grow. As the inaugural CEO of Banner Gateway Medical Center, I was on hand for that very first site visit by the MD Anderson Network leadership. In May 2009 came the announcement regarding the creation of Banner MD Anderson Cancer Center, followed by the opening in September 2011. Since then, we've developed the footprint across central Arizona and expanded into northern Colorado, culminating in the hiring of a nationally respected leader to run the program, Dr. Rogerio Lillenbaum, earlier this year. Before you hear from Dr. Lillenbaum, Lamont Yoder, the Chief Executive Officer of Banner MD Anderson Cancer Center, will share some background regarding where our cancer program originated and how it has come to be so well positioned to advance the science of oncology during this pivotal point in our history. Off to you, Lamont.
Great, thank you, Becky. I have to start by saying it truly has been an honor and a privilege to work with the amazing physicians, team members, and our patients at the Banner MD Anderson Cancer Center for the last 8 years and in the last 5 years as the CEO. In the first slide I share here, the top left picture, this is perfect to share with you as we celebrated just a few weeks ago, our 9th birthday of the Banner MD Anderson Cancer Center in Gilbert. Our opening celebrated the most comprehensive extension of the University of Texas MD Anderson Cancer Center and their world-renowned model of disease-specific, patient-centered, and coordinated cancer care. It has been also over a year already that we celebrated our 1 millionth patient visit, a significant milestone to what truly has become the destination for cancer care in Arizona. And today, over 1,000 people each month hear the word cancer for the very first time and choose to come to us for their cancer care. As Becky mentioned, and you can see in the pictures here, Banner MD Anderson has extended our reach in Arizona with clinics at Banner Desert in Mesa, Banner Thunderbird in Glendale, and Banner Boswell in Sun City. Additionally, a new 3-story Banner MD Anderson Cancer Center opened last summer on the campus of Banner University Medical Center, Phoenix, in the heart of downtown. Our mission of making cancer history is real. It is expansive and sincere. That little red line that strikes out the word cancer in our name means a great deal to us. We focus daily on it to truly make cancer history. When Banner MD Anderson first opened, we had a small team of just 8 physicians and less than 100 employees. Today, we are almost at 200 physicians and advanced practice providers, and we have over 800 employees total in our growing and expanding sites of care for Banner MD Anderson. I've experienced firsthand the real reason for that rapid growth of Banner MD Anderson and the resulting impact to so many people in our community. For me, I've spent over 30 years in healthcare, started from a nursing assistant on night shift to chief nurse executive roles in 5 different hospitals and in 3 well-known healthcare systems in Arizona and Ohio. Now as CEO for the past 5.5 years. I saw people in every setting who truly cared. But the cancer journey here is different. I recall my first week as our new chief nurse 8.5 years ago, attending what we call tumor board, where the entire team comes together. There are medical oncologists and surgical oncologists, radiation oncologists, imaging physicians, pathologists, and just many other team members that all come together and focus on one specific tumor type or disease type for that one specific patient's new diagnosis. Together, I was truly blown away watching the cancer team all review together the science, the evidence, the options to come up with the right course of treatment for that one cancer patient's journey. I can share that from my experience, many other places have tumor boards and many people know about them. And those terms are used elsewhere, but I personally had never seen them work like they do here at Banner MD Anderson. Large groups of specialists all together in one place focused on one specific type of cancer, all working together. I saw our colleagues, sometimes from MD Anderson in Houston, also join those forums. It was just amazing to me. Because of that experience, I understand why it really is different here. And I also understand why I personally get so many letters every week of thanks and gratitude, sharing stories of the life-saving treatment that happens at Banner MD Anderson. That's what I'm most proud of in our rapid growth. Not the large numbers, but the stories of saving lives. The stories of our compassionate teams that provide a cancer journey that is worlds apart from many other options that I have personally experienced. The story sharing of how someone was told the outlook didn't look so positive, but because of us and our additional offerings for cancer journey, care, and our research program, they share their stories and their letters of making the birthdays, weddings, graduations, and holidays that's a result of coming to us for their care. All of this is only possible because of how expert our physicians are and their expertise that they have brought to us and the University of Texas MD Anderson Cancer Care, their model of care to Arizona. There is truly no one better to share more about that than my friend and colleague with whom I enjoy working with every day, Dr. Rogerio Lillenbaum. Dr. Lillenbaum?
Thank you so much, Lamont, and welcome everyone. I appreciate you joining us tonight on a virtual platform. I know I speak on behalf of everyone that we all wished we could be together tonight. And yet we really appreciate you making the effort to do this on a platform that still is somewhat impersonal to us. So thank you and welcome, and I hope that the information that we share with you tonight is helpful and informative to everyone. Lamont, thank you so much for sharing your personal journey. And I can say on my behalf and everyone that I have met at Banner MD Anderson that we would not be here tonight and where we are today as a cancer program without your dedication and your commitment to the program. I would say the same about Becky Kuhn, who has since the very beginning held Banner MD Anderson very close to her heart. And I know that it's true today as well. If I can have the next slide, please. Our program rests on 3 principles: excellence in clinical care, patient-centered care, and integrated delivery of care. As far as excellence in clinical care, we have the best physicians, the best advanced practice providers, the best nurses, the best clinicians, really, who have dedicated their careers to become experts in a field of cancer. Next, please. When you look at how we function as a multidisciplinary program, you see on the slide that on a matrix of our 8 divisions and the 4 regions in which we operate sits the foundation of our care, which are the multidisciplinary programs. So you see surgeons, medical oncologists, radiation oncologists, physical therapists, pathologists, and radiologists who all come together to provide comprehensive care to patients with one disease: breast cancer or lung cancer or colon cancer or melanoma, etc. And these people live every day. They wake up every morning and they go to bed every night thinking about how they can improve the care that they deliver to their patients. This is excellence in clinical care, and we're very proud of how we do it, not only because the individual expertise that each of our team members has, but because we do it together. We do it as a team. Next, please. What do we expect out of our programs? We expect that everyone who walks into every Banner MD Anderson facility with a certain disease, breast cancer, for example, will receive the same standard of care. We also expect that our team members will adopt national standards for quality and safety, that they will promote the academic mission, education, and research, that they will make sure that all the specialties that are important for that particular disease come together in an integrated fashion. We work together with the Banner hospitals and their leadership, and we, of course, not only collaborate with the local communities, but we work on behalf of those communities. Next, please. We cannot forget that for Banner MD Anderson, excellence in clinical care means that we are joint at the hip with our research mission. And Dr. Dragovich will explain this to you and how we do it in a few more minutes. Next. Patient-centered care, our number 2 pillar. And I want to ask you to take a minute to read this quote from a friend of mine who spent her entire career as an oncology nurse, and who very wisely picks up on this notion that patient satisfaction is really about welcoming patients and making their experience, relatively seamless. For us, that's the minimum level of expectation. This goes without saying. A patient-centered culture really is the totality of what patients go through. The clinical piece, the operational piece, which we'll talk about in a second, the cultural piece, how people feel when they are in our hands, when they trust us with their safety, right? And the financial piece. And we know today how difficult it can be for patients and families when they finish their treatment, or even when they are in the midst of their treatment, to receive unexpected bills or bills from different sources that they can't understand. Everything is part of this patient-centered culture. So it's everything that that person in front of us, that day, that moment, goes through during this journey. Everything we do in our cancer program has this person, Sophia, at the center of it. Next. One example that we don't usually think about as part of a patient-centered culture is access. And we have promised ourselves, and we have promised our community, that we will provide prompt and seamless access to all of our specialists. No one should be in a position that when they're given a diagnosis of cancer, that they have to wait sometimes weeks to be seen by a cancer specialist. It is our obligation to be able to open our doors and make sure that that individual has a place to go and a place to talk, someone to talk to about what just happened to her or to him or to a loved one. We are making true on this commitment, and we are going to be very soon where we need to be to accommodate everyone that comes to MD Anderson seeking care and support. One other example of this are patients who happen to be diagnosed when they are admitted to a hospital. They don't know necessarily that they have cancer ahead of time. They are not feeling well. They are brought into the hospital. They get admitted. They undergo tests. And at the end of the day, they are diagnosed with a cancer. We are going to be there for them. We will meet our patients when they need us and where they are, not when it's convenient for us or for anybody else. And it's important to know this. I put a lot of emphasis on this concept because for many cancer programs, despite their expertise and despite what they have to offer, it's really hard to get to them. It's not hard to get to us. It should not be hard to get to us. So we're going to make that happen. Next. As far as having an integrated delivery system, the first relationship that we have is with MD Anderson Cancer Center in Houston, the #1 cancer center in the country, if not the world. Our physicians visit with Houston physicians on a regular basis. We collaborate on clinical trials and research studies. We have tumor boards with physicians in Houston. Our radiation oncologists, for example, have what they call chart rounds every Monday morning. Every patient diagnosed with cancer who needs radiation oncology or radiation services will be presented at that conference, where physicians from Houston and physicians from Banner MD Anderson, Arizona, and Colorado will discuss the best approach to that patient. We have now algorithms or tools that when we enter certain types of information about the patients, that we will have access to what is considered standard of care, to what is considered cutting edge care, so that no one misses any aspect of this truly complex, multimodality treatment that we are so proud of offering our patients. And our programs, as we discussed, are really the cornerstone of how we touch patients, how we touch families, right? There's a lot of work that goes in the background of a cancer center, but yet at the end of the day, where we touch families, where we touch patients is through our multidisciplinary programs. Next. So with this in mind, we are developing a Banner MD Anderson signature care. It's one standard of care. It's a consistent experience for patients and families. It's quality care closer to home. It's one-stop shopping, not the fragmentation that we sometimes see in several cancer centers. And we are going to leverage digital medicine to make it easier for our patients to reach one of us when needed. Next, please. So at the end of the day, we look to our future with a great deal of optimism, a great deal of enthusiasm. We are absolutely convinced that we will occupy the place that we need to occupy in order to serve this community. We will be the premier cancer program, not only of the state of Arizona, but of the Southwest of the United States. You have our promise and our commitment that we will reach our goal. And now, in order to tell you what we're doing from an academic perspective, from a research perspective, I'm proud to ask my colleague, Dr. Tom Dragovich, our Chief of the Division of Clinical Research and Interim Chief for Cancer Medicine, to present the opportunities that we have in research for cancer. Thank you, Tom.
Thank you, Dr. Lillenbaum, for the kind introduction. I'm really privileged to be here. I hear there is a lot of people in attendance. Some of them may be familiar faces. And I'm really, really humbled to speak to you because of your commitment to Banner MD Anderson Cancer Center. In fact, that many of you have contributed to some of the achievements in the space of clinical research that I will share with you today. I'm also very excited to tell you about how can cancer research really bring hope to patients and families, not just in Phoenix and Arizona, but as Dr. Lillenbaum stated, Southwest USA. We really are positioned to deliver research to patients. And I can tell you because I've been here since the inception of Cancer Center, we have made some great strides in delivering excellent cancer care. And I do feel that the access to top clinical research is one of the silver linings of this program. And it's my hope that with your support, we'll come far on this journey of hope. Next slide, please. As an oncologist, I can share with you that clinical research is almost inseparable from practice of oncology. Many of my colleagues tell me, you know, this is what really drives the practice ahead. And we used to wait for years, sometimes 5 or 10 years, to see new drugs coming from the laboratory research to clinic. However, because of the great impact of genomics and immunology research, we're seeing these breakthrough achievements moving from laboratory to the clinic in 3 years, even less than that with some of the immunotherapy. And this is the result of clinical research. However, the stakes are still very high. You may not realize that more than 1,500 Americans are lost each day due to cancer. That amounts to about 600,000 lives a year, about 1.8 million projected to be diagnosed with cancer this year. So talking in the times of another healthcare crisis, it just tells us that cancer research and cancer therapy can be put on hold and can't wait. So I hope I impact this sense of urgency on you for translating promising research finding into treatments that prolong life or cure cancer. And I can tell you that we have a long race ahead of us. The horizon looks bright, but it's time to go after that. Next slide. And as you can see here, expressed in our Banner MD Anderson research vision statement, our intent is to be at the head of that race, not at the back of it. And that's why we need support from people like yourself, from community and corporate partners to keep us at that high pace. We are very responsible our clinical research, and we like to implement it in a safe and ethical manner. We owe it to our patients and their families. And also, it allows us to bring the best and brightest physician and investigators to our program and allow them to conduct these innovative studies that are bringing merit to institutions both nationally and sometimes internationally. And this really sets up opportunity to collaborate with our partners, with MD Anderson Houston, with Banner Research, with our partners in Arizona and beyond, because this is too big for one institution to do it alone. And this is the power of research. It brings investigators and brings institutions, it brings states and people together. Next slide. I'm proud to share with you some of the achievements that we have been able to strike as in the last 3 years as we focused more of expanding our clinical research enterprise in oncology. We have enrolled over 1,100 patients. We have opened more than 180 trials. Some of these led to new cancer, approved new cancer therapies that are now available in clinic for our patients. And we're also proud to be the first center in the world to enroll patients in 3 of those clinical trials. and very proud to be the first site in Arizona, and I would say Southwest, to open a CAR T trial, which, as you may have heard, is revolutionary therapy with genetically engineered immune cells that are used to fight sometimes incurable blood cancers, lymphomas, and we're now expanding this program in patients with solid tumors. Next slide. This resulted in a large number of high-value publications from our physicians. We have organized 3 research symposia that brought together our collaborators, national, local, industry, pharma, and NCI-sponsored programs, as well as patient advocacy groups. We also feel that we demonstrated that innovative research such as CAR T therapy, radiopharmaceuticals, really elevates our level of clinical innovation for our institution. And as Dr. Lillenbaum mentioned, we want to bring this excellent care, including clinical research, to our patients, because I can tell you firsthand, it's not easy to worry about traveling to Houston or Sloan Kettering or Rochester to get that type of care when you're facing cancer and your family is struck with all kinds of stresses and difficult challenges every day. So we're doing our part to try to bring it to our patients at our regional sites, both in Arizona and Northern Colorado, where we started actually this year. Next slide. As you can imagine, this takes a strong team, a village, as I say, and we have built a very strong foundation, very dedicated team of research nurses, data coordinators, regulatory nurses, really a lot of great talent here. But we need to grow this team because needs of our patients, as you have seen, and our volumes are increasing. Next slide. Next slide, please. And talking about needs of our patients, we do, I always feel that we have this sacred covenant with our patients that participate in clinical trials because they're really giving us their time, their energy, and their hope for all the right reasons. And we have to do it right. We have to be excellent at this. And there are many stories, and I will share 3 of those. And I'm really grateful for the patients and their families that allowed us to share their stories with you. And I will use their first name because I happen to know all of them in person. And there are different stories. In this case, on the left-hand side, we have Darren and Ray, and both Darren and Ray have been able to receive what I would consider life-saving therapies on the clinical trials, coming in with a very scary diagnosis that had a high risk of not a good outcome. I have to say both of them are well on the way to recovery and long-term remissions. On the right-hand side is Kathy, is my own patient that unfortunately came to me with stage 4 pancreatic cancer. And Kathy really came to us because she wanted to take a part in clinical research. She knew how the grim prognosis was. And as we were parting at the end, she said, you know, I really feel that those trials helped me snatch away 2 years of good quality of life and things I wanted to do from this terrible disease. So again, as I said, we got to do it right, and we owe it to this wonderful group of people and their families that we see every day. And I'm really, really excited to see many, many more of them in our waiting rooms that would not have been here had they not been participant in the clinical trial. So I do see a bright hope for our patients and their families as we build this research enterprise. Next slide, please. The other side of this battle or this front are our physicians, our champion investigators, and they derive the time and energy, and it's really by a large extent labor of love to bring these trials here, to develop the trials, and to really conduct it in a safe and ethical manner. And I have to say that we were very fortunate to have some of these excellent people in our program who were able to publish it world-class medical journal and present at the international caliber meetings, such here as we can see with Dr. Munoz and Dr. Lida Mina. So it does, as I said, research brings people together, and it tends to bring best and brightest together as well. And we're very fortunate for that here at the Banner MD Anderson Cancer Center. Next slide. So I would like to thank you at the end for partnering with us in our clinical research program. As I said, many of things we have achieved in these first few years in our short history would not be possible without your dedication and commitment, for believing in hope of cancer research, for really being the leaders in community and society. It means a lot for our physicians that they know that their community is really supporting their efforts, especially in this area. And thank you again for staying engaged, connected, and determined to, on this journey to put an end to cancer, together with all of our staff and physicians. Thank you.
Thank you so much, Tom. Thank you to all of you for listening to the presentations. I hope that you sense our commitment to excellence in clinical care, including research, how our focus on the patient and the family, and how we are committed to developing a network of Banner MD Anderson facilities that deliver signature care for our patients. We are about to open the Q&A session, which Becky Kuhn will moderate. Before we do that, however, I want to just take a minute or two of your time and tell you how important philanthropy is to the mission of the Cancer Center. As a non-profit organization, we invest all of the proceeds of the cancer program into program development, into expansion of our clinical and non-clinical services for patients and families, and in the ability to create a research portfolio that will meet the needs of all of our patients, regardless of the disease they have or the stage that they have. And we cannot do that without the generosity of donors and people who care about the work that we do. I know that some of you on this program have supported Banner MD Anderson, and on my behalf, on behalf of Becky Kuhn, Lamont, Yoder, Tom Dragovich, and everyone at Banner MD Anderson, I want to thank you for your support. It means a lot to us, and we don't take any of that for granted. We have very ambitious plans ahead of us. We want to continue to develop excellent programs that include every service that patients need at every stage of their journey. We want to expand our ability to have the most cutting edge research trials available to our patients without having to leave the facility that they choose to go to and to leave their communities. This is an enormous undertaking. And for that, we count on all of you to help us on this journey and to achieve our goals. So I appreciate once again you being with us tonight, and consider helping us and supporting us in this mission. So with that, I'll return the microphone to Becky Kuhn. Becky, I think you're muted.
Thank you for that. Yes, thank you. I just want to say thank you to all of our panelists and to all of you for participating in our virtual program today. We hope you've found this both interesting and informative, and as a reminder, there will be a recording of the presentation that will be available on the resource webpage. A follow-up email to all registered attendees will provide that link to you, so feel free to share the information. And now we'll use our remaining time together to allow you the opportunity to ask questions of our esteemed presenters. So please use the chat function at the bottom of your screen to provide the questions, and I'll direct them to the most appropriate responder. Any questions we do not have time to address today will be added to the Q&A section that will be posted on the resource page following the event. So let's begin, and I'll pose the first question to Dr. Dragovich. And that is, will my physician at Banner MD Anderson have access to information about all available clinical trials for my form of cancer, whether those trials are available at Banner MD Anderson or not?
Thank you, Becky. Yes, I would say the answer is yes, and definitely they do have access to clinical trials that are available for specific type of cancer. Of course, at Banner MD Anderson, which would be a convenient option for patients that live in Arizona, but also most importantly in MD Anderson, Houston, as well as other cancer centers around the country. So I would encourage patients always to discuss these things with their physicians. I would say most of our physicians are very much aware of the importance of cancer research, and they would probably provide advice and counseling on their own.
Thank you for that. And let me do a follow-up to that, Dr. Dragovich. How does a patient become a participant of a research or clinical trial?
I would say that we're talking about cancer trials here. A patient is usually seen by the oncologist, either in community or as seen by one of our oncologists here, Banner MD Anderson. And based on their type of cancer, the stage of cancer, other important clinical factors, usually the option of clinical trials is discussed at that point. Patient can also find about clinical trials from our website, and then can also find out, we have a research hotline where, patients that have a specific interest in trials that they know are open here, but they're not currently patients at Banner MD Anderson, can reach out to our staff and inquire about the ability to participate in clinical trials. So, that's the first step, and then, we'll follow through, and we hopefully guide them to the best option in terms of clinical trials if they're an option.
Yes. Thank you, Dr. Dragovich. And this next question is for Lamont. How long has Banner MD Anderson Cancer Center at Banner Deli Webb been in existence? And do they offer both radiation and chemotherapy treatment?
Yeah, I'll start, and Dr. Lillenbaum let you share a little bit also about the plans moving forward. Del Webb is one of our newer sites in the last year, and fortunately for the folks in the community there in the Del Webb area, Banner Health has two campuses close at Del Webb and Boswell, so Sun City and Sun City West. Del Webb started with has a very large and growing breast cancer program, and is working with the infusion site at Boswell, and we're expanding in the infusion area there at Del Webb too. So Dr. Lillenbaum, you want to share a little bit about maybe what we have now as a newer site, but our plans over the next year? That would be great.
Thank you, Lamont. So we have as you said, a growing program at Del Webb. I want to mention specifically the work that Dr. Kelly Rosso has done with the breast program at Del Webb, which is rapidly becoming the reference for breast cancer patients on the northwest side of the valley. It's a fantastic program. She has colleagues from multiple disciplines who work with her in a multidisciplinary fashion, and has had a tremendous success in outcomes that are very much patient-centered and include aspects of the treatment that we sometimes don't think about. So one new addition to that program at Del Webb is plastic surgery, right? And think about women who have surgery and sometimes part of the breast is removed. At times, even the whole breast is removed. And there are several reconstruction options for women to entertain at that time. And now we have specialists that have joined us in the past 12 to 18 months under the leadership of Dr. Michael Miller and Dr. Michael Chody, who come from the best centers in the country, who can discuss with every patient with breast cancer the best option for reconstruction. So that's an example of how DelWeb has evolved, considerably as a treatment center for Banner MD Anderson. We also have, I know a question came up about radiation. We have a radiation facility at Thunderbird, which has been there for a little while, and it's ready to expand and to grow. And then we have a program at Boswell that includes both medical oncology and surgical oncology and radiation oncology as well. I don't think I would be breaking a protocol, and with Becky's permission, let me share with you that we have plans to build a comprehensive cancer center in the Northwest Valley for Banner MD Anderson. And hopefully this will happen in not too distant a future where all of our specialists and all of our services will live under the same roof. So we have tremendous plans for expansion in the Northwest.
Thank you, Dr. Lillenbaum. A question, Dr. Lillenbaum, follow up for you. Will you be getting the ability to do lymph node transplants or bypasses here in Arizona? I know MD Anderson in Houston can do them now.
So I appreciate the question. As of now, we don't yet have that ability, but we are collaborating with Houston, to bring that technique to Arizona. I don't have a precise estimate as to when that technique or treatment will be available, but we will, as a result of our collaboration with Houston, we will have that treatment available to us as well.
Very good, thank you for that. Dr. Dragovich, this question is for you. Is immunotherapy widely available now for all forms of cancer, or is it still fairly experimental?
Thank you. This is a very, very important question. It is specific to the cancer type. I wouldn't say it's available for all types of cancer. It has been tested and shown to be effective in some of the cancers, like melanoma, skin cancer, lung cancer, some of the hematological cancers and others, but it's not across the board for all types of cancers. We are, however, increasingly more doing trials where we're trying to find if we can even convert those types of cancers who do not usually respond to immunotherapy responsive. So it's always important to consider a clinical trial option if that's of value for that particular case or patient.
Thank you for that. And Dr. Dragovich, another question. My doctor is not an oncologist. How are other physicians connected to the research?
Well, I think this applies to any physician in Arizona that wants to refer the patient to Banner MD Anderson Cancer Center. I assume the question relates to cancer research because, this is what we do. We don't do cardiology research or other types of research. But if it's a cancer research, sometimes there are studies that we do in the sphere of preventing cancer or early screening of cancer. And you may argue that those patients do not necessarily have an oncologist, but they're seeing their family practitioner. It's simple referral process, and we're happy to see that patient. We have also a high-risk clinic here that sees patients that have a high risk of developing cancer because of the familial cancer, hereditary cancer, or other higher risks than average population. So I would say the usual referral process would apply.
Very good, thank you for that. Lamont, next question is for you. You shared your experience of the cancer journey in Banner compared to other hospitals and healthcare systems over your career. I'm curious to hear about your role in the business side of healthcare, what you believe is the biggest success in the partnership between Banner Health and the University of Texas MD Anderson.
Yeah, thank you for that question, Becky. Overall, for anyone in healthcare, our most important success always comes to the patients, and for us, it's the lives we've saved because of the level of excellence in cancer care that has brought Banner Health and University of Texas together in this partnership. But if I would look at my role specific to the business side in healthcare and with that CEO hat on, I would have to say, honestly, Banner Health provided a lot of cancer care before our partnership with MD Anderson 10 years ago. Yet this partnership really has brought an entire new level of physician expertise. We set the bar even higher for cancer care in Arizona, and it's really, I would say that for me is the biggest business success. It's been bringing in the top pedigree physicians from around the country. Our physicians are fellowship trained in cancer care, and most all of them focus on a specific disease or one tumor or two tumor types. And that's really why our patients come to us for care, because we are continuing to see top cancer physicians from around the country take notice of our program and of Banner MD Anderson, and are constantly asking Dr. Lillenbaum and our physician chiefs to join our team. So I would say that's our biggest success.
Okay. Thank you, Lamont. Dr. Lillenbaum, another question. Even if I don't have any indications of cancer, can I still get genetic testing done at Banner MD Anderson if my mother had breast cancer?
Yes. So the answer to that is yes. There are certain types of breast cancer that have a genetic foundation. It tends to cluster in families. It's the same for certain types of ovarian cancer as well. So we have a team of genetic counselors who specialize on this subject and are more than happy to provide not just the appropriate test for this situation, but also counseling once the test results come back. So we absolutely would love to help in this situation.
Thank you. Lamont, this question is for you. Does Banner MD Anderson receive funding from MD Anderson Cancer Center in Houston?
Yeah, that's a great question. We get asked that quite a bit. The short answer is no. But to share a little bit more perspective, in our partnership with MD Anderson in Houston, I would say we each bring our expertise to this partnership. Our Houston colleagues and programs bring their clinical expertise and supporting our physicians to ensure the care we provide at Banner MD Anderson is at the level of excellence they expect as the top cancer program in the country. And in Banner Health, we bring our operational expertise to this partnership in delivering care as the largest provider of patient care in Arizona. So we all own aspects of this partnership, but the business operations, including financial support of the program, is Banner Health still. Thank you.
Great. Thank you, Lamont. Dr. Dragovich, this question is for you. How has the COVID-19 pandemic impacted your research and treatment programs this year?
That's a great question and very impactful question for us. As I said, the cancer poses a great risk for health for a lot of Americans. So you have to almost weigh which risk is higher. And the other aspect of this question is cancer patients are somewhat more vulnerable population to COVID. So we really had to walk a very fine line to refine our priorities and our processes in order not to delay cancer care to patients that need it, and the other hand, not to overexpose vulnerable patients to COVID-19. So a lot of effort and work went into this. I have to say that we have never stopped our clinical research program due to COVID. We have initially prioritized trials that have a life-saving capabilities or disease-changing capabilities and moved forward with those trials as priority. But right now we have removed some of these restrictions, and we're fully open to all patients with all different types of cancer needs in terms of clinical trials. So, yeah, thank you.
Lamont, do you offer diet and lifestyle counseling or assistance for your cancer patients?
Yes, absolutely, we do. Our integrated medicine and wellness program offers an entire continuum of services for supportive care and care that goes along with the comprehensive care program. Dr. Lillenbaum, I think, sharing a little bit about some of the medical aspects in all the care continuum around the integrative medicine and wellness program would add additional flavor to this outside of just nutrition in those areas. Do you want to comment?
It's I would say a collaborative approach. We do have expertise within the cancer program to guide and counsel our patients in certain situations. It's also part of the conversation that our clinicians have with our patients as well. And it's, as a clinician, I always tended to ask for our nutritionists, for example, to engage in the care of patients who were having more difficulty, for example, with certain types of treatment than others, or have certain types of cancer that tend to affect their nutritional status more than others. So we have access to certain interventions also that can be helpful in the management of nutritional issues during cancer treatment.
Great. Thank you for that. I'm going to read this question, and then whoever would wish to respond, please do so. I am 1 year into my survivorship program of breast cancer, but my medical oncologist didn't know much about how the program worked. I was scheduled for an appointment, which was abruptly canceled because it didn't meet the requirements. Will the oncologist have more training about the survivorship program so patients like myself are not disappointed by being told that they are too early to participate?
I'm happy to take that question, Becky. Well, I think the question is really important for two reasons. One, it highlights how we integrate survivorship in our comprehensive plan for cancer patients. It also highlights that some of our medical oncologists don't yet know how to utilize that resource, in a way that facilitates the care of that patient. And so I think the question is correct. I come from a generation of oncologists, I should say, that continue to follow patients even after the first year, even after the third year, even after the fifth year, and sometimes even after the 10th year, because that's how we were trained. And the concept of survivorship was not yet as mature as it is today. So I actually appreciate the question, because it shows that we have some work to do as to how we bring not only the concept but the practice of survivorship into the multidisciplinary programs in a more seamless manner. So thank you for that comment.
And we will have one last question to close out our Q&A section, and this is for Dr. Lillenbaum. Are there any recent advances in the field of oncology, like new ways of delivering radiation or chemotherapy, or anything really promising in terms of the hope for a cure?
Yes, thank you again for that question. We hope for a cure every day. And every patient we see, we believe that we can make a difference. If you think about where cancer medicine is today compared to where it was 10 years ago, it's a generational change. We now have targeted agents. So for certain types of cancer that arise from a specific mutation in the DNA of the tumor, we now have oral agents, pills, that people can take that will absolutely and sometimes completely suppress the growth of that tumor, and at times leading to an eradication of that disease. So targeted agents have revolutionized the way we approach cancer care. Immunotherapy is another extraordinary advance in the management of cancer, and one that in fact has broader application than targeted therapy has, because it can be applied to more tumors than targeted agents. And what immunotherapy does is it revs up the immune system, right? It allows the immune system to identify cancer cells and fight them and eliminate them. So just between targeted therapy and immunotherapy, the approach to cancer treatment today has changed completely. On the radiation aspect, just to finish, we have newer modalities and techniques beyond just the conventional 3D technique. We have IMRT, we have proton therapy, we have other modalities that will lead not only to better outcomes, but to less complications from the treatment. So we keep thinking about this, and we keep developing these techniques so that we can offer a better chance of cure for our patients.
Thank you, Dr. Lillenbaum. So let's close this out. Banner MD Anderson remains committed to providing the very best in cancer care with a comprehensive and coordinated approach. I have the privilege of hearing so many positive comments from patients and their families. It is so uplifting and heartwarming to hear the impact that the Cancer Center makes on so many. I also have the experience of both the diagnosis and treatment through Banner MD Anderson Cancer Center, and I can personally attest that it's an amazing place to come for care. So I'm very happy always to highly recommend it to everyone I know. So with that, let me just say thank you to all of the donors to our program. It's due to your generosity that we can advance oncology care and service, and it means a huge amount to each and every one of the patients and families that we serve, and also to the physicians and other providers and clinicians who are providing that amazing care each and every day. We could not do this without you. So thank you so much. Thank you to Linda Lotz and the Banner Health Foundation for sponsoring and organizing today's conversation. We appreciate the opportunity to spotlight Banner MD Anderson Cancer Center. And thank you to our inspiring patients. We are honored by the trust you place in us each and every day. Thanks again to everyone who participated today. Stay safe out there and watch for the follow-up email with the link to the resources page from this program. We welcome your feedback too, as we strive to provide meaningful content to our virtual At Home Together programming. Thank you all. Be well, stay safe.